placing implant in the aesthetic zone. When you want to place implant in the aesthetic zone, what do you want to do after placing implant? You want to do temporaries, right? And in order to be able to do temporary, you need an implant that can allow you to do this. It's like in orthopedics. Today, when you break your leg, will you stay like this or will you walk on the same day? People want to walk. And in implantology, we need to place the crowns immediately. So we move from old protocols, like 6 months loading, to 4 months, to 3 months, and now we do immediate loading in the aesthetic zone. But to do immediate loading in the aesthetic zone, we need to have the proper implant. So today we will talk about how, by choosing the proper implant, we can do immediate loading in the aesthetic zone, and this will help us preserve aesthetics, especially when you have immediate implant in an extraction socket. You know the problem of extraction sockets. If you extract a tooth, what happens? The bone will resorb. So we need to make bone graft. I will show you some clinical cases and we can discuss. This is case okay. Now when we do an implant, aesthetic restoration, we need to have a good contour, no recession. We need to have the papilla. We need to have a convex contour, which means that we need to have the bone. Not working. And in order to have this, you need to have the implant in the middle. This is why you can have long-term results. If you want to have nice gingiva, nice bone, it is very important to be able to respect the bone when you place your implant. You see how much tissue we have. If you want tissue, you need to have a good bone reconstruction in order to have a good tissue. Otherwise, you will have failures in the aesthetic zone. Failures in the aesthetic zone are very difficult to handle because this implant, then you need to remove. If you remove it, you need to remove the bone. You need to recreate everything, especially when you are dealing with an implant in the extraction sockets. This is why today we will talk about the importance of placing implant into extraction sockets and how we have to reconstruct the bone prior to implant placement. So we need to have bone and soft tissue available. We need to use the proper implant geometry. We need to place the implant ideally, and we need to understand the biology around the implants. Like a natural tooth is different from an implant. Different biology, different physiology. We need to be able to planify ideal implant placement. You need to have enough bone on the mesial, enough bone on the distal, enough bone on the buccal because you want to protect your implant restoration. This is why it is very important to use the good implant geometry. Now, if you look at this case, why did I lose the papilla here? You know why? No papilla? Why? Because the implant was very close to the natural tooth. When an implant is very close to the natural tooth, we lose the bone, and if we lose the bone, we lose the papilla. This is why it is very important to choose the implant accordingly and to place in the natural place. If we don't have bone, we need to recreate bone. In the afternoon, we will have a lecture about bone grafting and how we can recreate bone prior to implant placement. How we can recreate bone vertically in order to be able to go from this situation to that situation, more bone, place the implant, and then, as you can see here, if we do some soft tissue grafting, temporary, we recreate the soft tissue, and this is the final result. So it is very important to recreate the bone whenever you want to place an implant in the aesthetic zone. Look at this case. We have very little bone. The bone is very thin, and we want to place our implant. So when we want to place implant in very thin bone, you need to reconstruct the bone, because when we have bone envelope, we will be able to have soft tissue envelope and better aesthetics. This is why we will start by recreating our bone by doing a tissue graft and soft and bone graft. You see, this is the situation. What do you think about this bone? It's very thin. Okay? Maybe if I place my implant in a clever way, this is blue diamond implant from any ridge, and I place my implants. You think it is enough to leave the implants like this? If you leave the implant like this in the aesthetic zone with little bit of bone only, you will have afterwards a recession. This is why it is very important to reconstruct the bone. So we have to use a bone graft. We tried grafting in the palatal part of the bone. Then we put some sticky bone. This is S1 bone, it's a sticky bone that we put on the buccal to reconstruct the contour. Once we reconstructed the contour, we have to put a membrane. So we cover everything with a collagen membrane, and now we need to put some PRF in order to make a better healing of the soft tissue around the bone. Suturing technique is very important. We need to be able to close over our bone graft, because if we don't close over the graft will open, and if it opens, it will expose the membrane and we will have problem, infection. You do a very good closure. This is the situation afterwards. We put then our temporary in order to recreate our soft tissue contour, and we go from this situation to this situation. So you see that here now we have a beautiful aesthetic contour. We have a nice soft tissue. We have a lot of bone on the buccal that will protect on the long term our aesthetic restoration. This is why it is always very important when you want to do implant in the aesthetic zone to be able to reconstruct the bone and the soft tissue. And then the day that we will place our implant, you see how we respect our papillas. We place our soft tissue, our final crowns, and look at the bone that I have on the buccal. And this is very important to have the bone on the buccal, because this bone will protect my aesthetic restoration. And if I have bone, then I will have soft tissue. It's very important. In this case, for instance, also I have a bone defect. I don't have enough bone to place my implant. So you can either do it in one time or you can reconstruct the bone. Like in this case, we will do a graft to reconstruct the bone. We need to have more bone to place the implant. And then when we come back after bone healing, we look at the situation. Now we need to place 2 implants in this region. But we need to make sure that we have enough bone to place our implant. This is why we start by doing a CBCT. On the CBCT, we will be able to control the bone. And you see that I have enough bone. Bone is sick, but if I go back here, I see that I don't have soft tissue. So I have bone, but I don't have soft tissue. In this case, I will place my implant and then I will make some soft tissue grafting, connective tissue grafting, in order to have more soft tissue. I always take an intraoral scanner because we want to do guided surgery in these cases. With this intraoral scanner, we have the impression of the case. So this is my case now that I have it in a STL file. It's an impression of my case. I need to have also the occlusion. You see, this is the occlusion because now I'm going to planify to place 2 implants here with temporary crown on them. We use R2Gate software in order to do planning and to do immediate implant placement guided. On R2Gate, I do a virtual wax up, so I plan my cases, and then I place my implant accordingly to the future restorations. And this will help me also not only place my implant in the ideal position, but it will help me also prepare my temporary crowns, because these temporary crowns are going to be placed immediately after surgery. And you see, by placing my implant, I respect the bone on the buccal, I respect the relationship between these implants. So I prepare my guide. This will help me place my implant ideally in the ideal position. I prepare my temporary crowns. These temporary crowns I will use immediately after surgery because I want to send my patient with new teeth. I use a guided surgery system. And now I start my surgery. I don't do flapless. We don't need to do flapless surgery because we need the soft tissue. We need to reconstruct the soft tissue. If you do a tissue punch, you will lose the soft tissue, and this is something that we don't need to happen. So now I do a small flap elevation, not too big, just to expose the bone. Once I expose my bone, I place my surgical guide, and I start drilling through the guide based on the study that I already did on my software. So now I know where I am placing my implant exactly. And you see that I just follow the drilling protocol. Very easy protocol now. And once I finish my drilling, it is very important to be able to stabilize my implant. Why do you need a good stability for your implant? Because in this case, I am going to do a temporary crowns over the implant. I will not let my patient go without crown. So we do a immediate temporization because this will guide the healing around our implants. And this is very important. So you see now how I am drilling. 2.8 millimeter drill. And now we will drill the final drill, 3.3 millimeter drill. Once we did our final drilling, now we need to place our implants. These are the implants, any-ridge implant from Megagen. And it is very important to use the proper implant because you need to have a very good stability of your implant when you place them, because we are going to place the temporary crown. If we don't have stability, we will not be able to put our temporary, and we want to put our temporary for the patient. Remember, it's very important today to be able to do immediate temporization of the case. So when we place our implant, very important to control the depth of the implant and to control the position of the connection. And now you see that I'm torquing in my implant. I have more than 30 Newton centimeter, which is very important. I place my two implants, ideal prosthetic position. Now I need to reconstruct the soft tissue. So I take a connective tissue graft. I suture my connective tissue graft. Because remember, we have enough bone, but we don't have enough soft tissue. It is very important to reconstruct the soft tissue in this case. So we just make two sutures. And once we finish placing our soft tissue graft, we need to place our temporaries, because the temporaries will help us restore the contour. So you see, I put two temporary crowns that I prepared in advance because we did all the study on the software. We suture and we let the tissue heal around these two temporary crowns. Very important. This is the situation after my two implants, my soft tissue, and look how we go from this situation to that situation. So we see that now we had before a concave profile, but now we have a convex profile because we could reconstruct the soft tissue. And because when we put our temporary crown the day of the surgery, we will be able to heal the tissue around our temporary crown. This is why it's very important to make a immediate temporization, immediate loading on the implants. And if you want to do this, it is very important to be able to use the proper implant, as you can see here, because this implant stability is very important. And you continue with your case. Now, if we go to extraction sockets are more important and more difficult, because if you extract a tooth and you wait 6 weeks, for instance, you see how much tissue we will lose. So we don't need to lose the tissue after extracting a tooth. This is why today we need to find a solution. If we look at this case, after extraction, look how much I lost bone. In one case, I lost almost 50% of my bone. And this is something that we don't need to happen. It is very important in the aesthetic zone to preserve the bone. We don't want to lose the bone. We don't want to have a resorption of the bone. This is why we need to be able to do what we call today either ridge preservation, which means when we extract the tooth, we put the bone, and you see in this case that my contour will be the same. This is one solution. Like in this case, I want to extract this tooth. I remove the tooth. After removing, if I cannot place an implant immediately here, I do ridge preservation, I do soft tissue grafting, I let it heal, And look at the situation when I place my implant. I have enough bone to place my implant. I put a healing abutment, and then I put my final restoration after 9 months. But do you think 9 months is something that we can accept today? Today we have to place our tooth as soon as the first day. 9 months is too much. This is why we need to go with accelerated protocol, which means that we don't want to do only this. We want to place our implant immediately. And to place our implant immediately, we need to follow some rules, which mean being able to extract the tooth atraumatic. We don't want to have trauma on the bone. Place our implant ideally, because it's a flapless approach. This is why we need to be able to use guided surgery. Use the proper implant geometry, because remember, we need to have a stability of our implant because we want to put a temporary crown on it. We need to do immediate temporization. This is why we need a good stability. Very important to have a good stability. And when we do this, we can preserve the soft tissue and the hard tissue. And we can send our patient after the surgery immediately. You see, this is the positioning, prosthetically driven. Then we take an impression. These are all cases. Today we do everything digitally. I will show you now. And we place our temporary and we let the patient heal properly. You see, a lot of authors talk about immediate temporization, immediate implant placement, but they don't put the temporary. Look, these are authors that are not placing the temporary. And why do you think these authors are not placing temporary tools? Because they're not using the proper geometry, bad implant geometry. Today we need to have high insertion torque, not low insertion torque. This is why we need a proper implant. Any rich implant are implants that can give us very high insertion torque, very strong. So when we place this implant, we need to have good insertion torque because we want to place our temporary crowns. I'll show you a case. So if we get back to this case, did we have the choice? Did we have to extract? If, for instance, I place an implant, I graft the gap, I place a temporary crown, I can perform my immediate implant placement. This is a case. I want to extract these tools. I want to do planning on R2 gate, and now I will do my surgery. So first step of the surgery, tooth extraction. We need to do atraumatic tooth extraction. In order to do atraumatic tooth extraction, we use different technique. I use ultrasonic surgery. You can use your technique, but it is very important to preserve the bone buckle because you don't want to have a fracture of the bone when you want to do immediately your implant placement. So we start with our tooth extraction. Once we remove our tooth, we need to make sure that we have enough bone on the buccal. This is the bone on the buccal that should be here. We need to clean because we don't need to have any granulation tissues or any infection at the site of implant placement. I debride my tooth. You see the granulation tissue I remove because you don't want to have any infection on your implant. And then I place my guide and I start drilling through the guide. Now you just follow the protocol of guided surgery that you prepared in advance. And this is very easy protocol. You drill different lengths, different diameters. And what is important in this case is to be able to stabilize the implant because you want to have a high insertion torque more than 30 Newton because you want to put your temporary immediately after the surgery. So this is the implant. In this case, it's a blue diamond implant from Megagen. I place my implant, and as I said, I need to guide. This is the line that will tell me how deep my implant should be, and this will show me where my connection should be because I want to place my temporary immediately, and I need to place my implant exactly as I did in my planning software. Remember that we already prepared the temporary. Everything was prepared in advance. Now we need to have stability. How much stability you need? 30 Newton at least. You see how I control the depth of my implant? And I control the position of my connection because I want to place the abutment. If the connection is not good, the abutment will not be able to be placed after the surgery. You see, I have more than 30 Newton centimeter stability, which is very important. Now that my implant is very stable, I need to graft the gap. This is the bone, bovine bone. I need to graft it. So you graft the gap because you don't want to have resorption of the contour. You need the contour to stay stable. Once I fill my gap, you see that now I have enough bone on the buccal. My bone is thick. I reconstructed my bone contour. Now I need to put my temporary because I want to guide my soft tissue control. It's very important to guide the soft tissue. I place my temporary and now I need to control my occlusion because you don't want to have more occlusion on this tooth. Exactly. If you have more occlusion, you might end up having problem on the implant. No laterality on the implant. So you see how now I control the occlusion on the temporary, and mainly I need to control the laterality on this tooth. You see that now when the patient will move like this, I don't want to have any trauma. You see, it's not touching anymore. This is very important, not touching, because this lateral movement on the tooth can lead to tooth failure. Remember, this tooth is immediately loaded now. So now that we finish our restoration, the patient will go with his tooth, we preserve the aesthetic, and we will help the soft tissue heal around this new crown that we place. This is the ideal placement of our implant, as you can see here. This is the healing afterwards. So you see how we could preserve the envelope, we could preserve the soft tissue, and this is the final crown that you can see here over your tooth. Now, you see how much bone I have on the buccal. It's very important, always important to have the bone, because this bone will hold our soft tissue and will preserve our aesthetic. In some cases, we can do other technique. We can do something we call root membrane technique, which means that we cut the tooth and we keep the buccal part of the tooth in contact with the bone so we can preserve the aesthetics. So with root membrane technique, we need to cut this tooth and leave the buccal part in contact with the buccal bone, because the irrigation of the buccal bone comes from the desmodontal ligament. And when you remove the tooth, you cut all of this irrigation, which means that you will have a resorption of the buccal bone. Now I remove the part that is on the palatal. You see, I remove half of the tooth. Now I need to prepare the buccal part of the tooth. So I make it thinner. Then I need to cut it until I reach the bone level. You see how I prepare here? I want my tooth to be at the bone level. And now I have to place my implant in the buccal part, in the palatal part, to have good stability, because also I want to place my temporary immediately. So this is not a guided surgery. This is freehand. When you do freehand, you have to make sure that you are in the right axis. This is the difference between guided, because guided makes things more easy. You can prepare the temporary in advance and you can do everything in freehand. This is the implant, Megagen implant. Very important to have a good implant because you need to preserve stability. Stability is very important. Once we place our implant, you can take an impression, digital or conventional. You send to the lab. If you do digital, you can prepare everything in advance, as I showed you before. My implant. And you see, this is the shield. This is the part of the tooth that I left. And then, you see how it heals? We have very good healing. Very nice contour. Now we need to place our final crown. And you see that here, my screw is a little bit to the buckle. This is one of the disadvantages of using freehand. This is why we prefer to use guided surgery in the aesthetic zone. So now what can we do? We either do a bonded restoration, or we can use these RC-based abutment from Megagen that will help us restore the angulation of the screw. So we move from here to there, and you see that now my screw is in the prosthetic space, and this is the final restoration, and you see how we could preserve the aesthetics. Show you a final case in the aesthetic zone. So this is a central incisor also. Now, if you don't want to do root membrane technique, the second solution is to place your implant more to the buccal and do bone grafting in the gap, because bone grafting will help us restore the restoration. So also this is planned using R2Gate. You see, this is the tooth I'm going to do. I do my virtual planning on it. I place my implant virtually in the ideal position. You need to have enough length for the implant for good stability, because you want to do immediate temporization. And you need to be more on the palatal because you need to graft the buccal space of your implant. So I always start by doing atraumatic extraction of my tooth. It's very important to make an atraumatic extraction, because atraumatic extraction will help us preserve the buccal bone that we have, our buccal bone. Once we remove the tooth atraumatically, we need to debride the socket. So we do a very good cleaning of the socket. This is what we call a socket debridement. Now we need to place our implant to the palatal. Very important to be in the palatal, because this is where the bone is. This is how you can preserve the bone stability of the implant. We use the guide because everything was prepared in advance. and we start drilling following the protocol of immediate implant placement that we prepared on our R2Gate software. So we drill until we reach the final length of the implant. We need to have an implant of 15 millimeter in this case, because you need to have a lot of stability above the apex of the tooth. This is the final drill, and now we need to place our implant in the palatal bone, as we said. Very important to keep in the palatal bone, because this is where you get the stability of your implant. When we place our implant, we need to be able to put at the perfect depth, orientation, have enough stability, very important, because we want to do our temporary immediately. And now we place, now we see the gap that is here. We need to fill it with bone. We need to do bone grafting of the gap, because this will preserve the buccal contour. If you don't put bone, you will lose the tissue, you will have aesthetic failure. So we put our bone, bovine bone, Boss from Med Park I use. So we fill in the gap. And now once we filled in the gap, what is the final step? To place our temporary, because the temporary will give aesthetic for the patient and it will help us restore the soft tissue contour, and this is very important. Now we put our temporary. You see, we are in the ideal prosthetic position. We make sure that we don't have any lateral forces on my temporary, because I don't want to put too much force on the implant. And you see my implant was placed ideally, and this is the situation after. So we see how we went to a situation where we could restore the soft tissue, and this is the soft tissue around my implant. This is my final aesthetic crown, and you can see that the soft tissue is still there, so we could preserve our soft tissue envelope, preserve our hard tissue envelope, and finally you can see the bone that I preserve buccal to the implant, and you see how I have very little resorption of my soft tissue contour. So this was about choosing the proper implant in the aesthetic zone, especially in the extraction socket, the importance of preserving the bone envelope, the importance of doing bone grafting, doing immediate temporization, and this is why you need an implant that can give you enough stability and a bone graft that can give you enough long-term result. So in the afternoon, we will have another lecture where we will talk more about how to recreate the bone, guided bone regeneration with full mouse cases. Hopefully I can see you and we can discuss more. Thank you.